Diabetic ketoacidosis, or the DKA, is the accumulation of acids in the blood caused by insufficient amount of insulin. Insulin deficiency causes problems with glucose, fat metabolism, and protein.
What is insulin? Insulin is a hormone that helps control our body's blood sugar levels and metabolism. Pancreas produces our insulin and releases it into the bloodstream. Insulin also helps our body to use sugar for the energy it needs and then store the rest.
So DKA happens when a lack of absolute or relative insulin prevents glucose from entering the cells for use as a metabolic fuel. This causes the liver to quickly break down fat into ketones as alternative source of fuel. So the overproduction of ketones causes accumulation in the blood and urine, and this makes the circulating blood more acidic. The gradual rise of polydipsia or excessive thirst and polyuria or excessive urination are the most prevalent signs of diabetic ketoacidosis. Also, the patient may have impaired vision, weakness, or even headaches. Gastrointestinal symptoms may also occur in ketosis and acidosis of DKA. These are anorexia, nausea, vomiting, and abdominal pain. The patient may also have acetone breath, or what we call as fruity smelling breath, because of the accumulation or buildup of acids in the blood. Fruity smelling breath is also one of the first symptoms that doctors check when they are assessing the patients with DKA. Hyperventilation may also occur having cosmos respiration, which represents that the body is attempting to decrease the acids, this counteracting the effect of the buildup of ketones. Mental status changes can be seen with mild to moderate DKA and more severe deterioration in mental status like comatose.
What are the diagnostic tests for diabetic ketoacidosis? We need to check the following: the blood sugar levels, the ketone levels, and the blood acidity. So why we need to check the blood sugar levels of our patients? If there isn't enough insulin in our body to allow sugar to enter to our cells, our blood sugar level will rise, or what we call hyperglycemia. As our body breaks down fat and protein for energy, our body sugar level will continue to rise. Next, we need to check the ketone levels. When our body breaks down fat and protein for energy, acids known as ketones enter to our bloodstream. Lastly, the blood acidity. If the patient has excess ketones in the blood will become acidic, or what we call acidosis. This can alter the normal function of organs throughout the body. The physician or doctor may order tests to identify underlying health problems that might have contributed to diabetic ketoacidosis, and also to check for complications. Tests might include blood electrolyte tests, urinalysis, chest x-ray, and electrocardiogram.
So the first nursing management is to monitor and maintain the fluid and electrolyte balance of our patient. The intake and output are always monitored. The IV fluids and electrolytes that are prescribed are the following. We have the 0.9% or 0.45 sodium chloride depending on the patient's sodium level and severity of volume depletion. Potassium is also added to IV fluids when urinary output is inadequate and is guided by continuous ECG monitoring. So here are the following signs of dehydration which nurses need to monitor. We have tachycardia, orthostatic hypotension, changes with breath sounds, level of consciousness, presence of edema, and also changes in cardiac status. So next nursing management is the administration of insulin as prescribed by the physician. So insulin therapy helps to inhibit ketogenesis. It also lowers blood glucose level and restore electrolyte imbalances in the patient. Insulin treatment lowers blood glucose levels by increasing the peripheral glucose consumption and decreasing hepatic glucose synthesis. It also reduces ketogenesis by inhibiting the release of free fatty acids from adipose tissues. Next nursing management is to decrease anxiety. As a nurse, it is our responsibility to educate our patient about cognitive strategies that may be useful for relieving tension, overcoming anxiety and stress, decreasing fear, and achieving relaxation. Next is monitoring and managing potential complications. So DKA without management could lead to complications. We have fluid overload, which can occur because of the administration of large volume of fluid at a rapid rate. So as a nurse, we have to monitor closely our patient during the treatment by measuring the vital signs and the input and output at a frequent intervals. Next is hypokalemia. So prevention includes cautious replacement of potassium and ensures that the kidney is functioning well. Next is cerebral function. This is more often in children than in adults. So this can be prevented by gradual reduction in the blood glucose level. Next is diet. So it is very important that patients with diabetes or those with DKA will have modified diet and lifestyle. So the main goal should be managing the blood sugar levels of the patient. So we have to recommend fatty fish, leafy greens, avocados, egg, chia seed, beans, yogurt, nuts, and broccoli. It is also important to eat foods that help prevent diabetes complications and heart diseases.
Next, ask the patient to wear an ID bracelet signifying that he or she has had a DKA episode. Next, we have to encourage the patient to quit smoking and abstain from alcohol because nicotine and alcohol can increase the blood sugar levels. Next, educate the patient to adhere to the given management and interventions by the healthcare providers. Diabetic ketoacidosis is treatable as long as it is diagnosed promptly and the patient understands the risk factors and is able to attend to its treatment and therapy. Next, we need to encourage the significant others to actively participate in the patient's treatment and therapy in order for the patient to become motivated to adhere to interventions and will recover immediately from the manifestation of the condition. Lastly, educate and demonstrate to the patient on how to administer insulin. In order to control diabetes and have good glycemic control, patients must have good knowledge about the disease and positive attitude towards self-administration, which will reduce the cost of management and related mortality.